Welcome to DMV Spotlight here in the nation's capital, where we shine a light on the issues impacting D.C., Maryland, and Virginia. My guest today is Tswana Sewell with the American Cancer Society. And as most folks may know, October is Breast Cancer Awareness Month. And I just want to thank you, Tswana, for joining me today on DMV Spotlight.
Thank you so much for having me and allowing me to speak to the work of the American Cancer Society.
Well, we all know that the American Cancer Society has been around for a very long time, and a lot of the advancements that we have seen in detection and treatment of cancers has really come about as the result of your work and at the American Cancer Society. Tell us some of the strides that you have made in terms of breast cancer, as it is Breast Cancer Awareness Month.
Yeah, thank you so much for asking. So the American Cancer Society, while we do a lot of things, we are heavily invested in research. And so right now we have $69 million invested in breast cancer research. And because of that, over the years, we have played a major role in many prevention, screening, and treatment advances that save lives from breast cancer today. So many folks may be familiar with the medicine tamoxifen. It's a popular breast cancer fighting drug. We funded the doctor that developed that medicine. We also established mammography as the gold standard for screening, and we funded the scientists that discovered the BRCA breast cancer gene. So due to that, over the last 3 decades, we have seen a decrease in the mortality rate of 42%, which means millions of lives saved from breast cancer.
And that is really amazing work that you have done. And I know that there are still challenges ahead, specifically when you look at the numbers that during COVID, like a lot of folks, we all didn't get to our usual checkups. We didn't get to the doctor for every thing that we needed to get to the doctor for. And what does that specifically mean for breast cancer awareness?
Yeah, so at the very height of the pandemic, we saw cancer screenings across the board were almost non-existent. They dropped significantly. Now we're looking at about a 6% drop still due to the pandemic, which means there are 2 million women across the country that are not up to date on their screening. And we know that early detection is the best and most effective way to treat someone so that they can have the most positive life outcomes. So we started a new campaign called Grab Your Girls, where we are asking women to be accountable for each other and to literally grab their friends, their sisters, their mothers, their aunts, their nieces, and schedule those mammograms. We know, again, that mammogram is the gold standard for detecting breast cancer. Our guidelines say, and the science really says, that a woman at average risk should start their mammograms at the age of 45. Certainly start talking to your doctor at the age of 40. But also at the American Cancer Society, we want people to be their own health advocates, right? We know that women are being diagnosed at a younger and younger age. So it's important for all women to talk to their doctors about their breast health and determine what is best for them. So we are really trying to move that 2 million who are out of date with their screening into doctors' offices so that they can get their mammograms so that we can save more lives from breast cancer.
I'm speaking today with Tswana Sewell from the American Cancer Society about Breast Cancer Awareness Month for October and the importance of, as you said, being your own advocate. Do you also recommend for, say moms to start talking to their daughters, and at what ages should younger women become aware of what they need to do to take care of their breast health?
Yeah, well, I think, this year alone, approximately 287,000 women will be diagnosed with breast cancer. So, to your question, absolutely, women at every age and young girls should be very aware of their bodies. I think, with moms, starting with girls at the pediatrician, just getting familiar with how their own breasts feel. You will be able to discover differences in your breasts. I know this is Breast Cancer Awareness Month, but, also young girls and young boys ages 11 through 13 are eligible for the HPV vaccination, which can prevent up to 6 different types of cancer. So for young people, folks have been saying, well, what are we doing? Why don't we have a shot? We literally have a vaccination that can prevent up to 6 different types of cancer. So since you mentioned younger women, I thought I would just throw that in there. But yes, it is absolutely important for moms to start talking about it, right? Like, let's normalize it and make sure that everyone knows what they need to do to protect themselves.
And then there has been over the years just some confusion about how often to have a mammogram, who should have a mammogram, what's the importance of knowing your family history in that, and how much do you have to advocate for yourself? And then let's go to the other end of the spectrum for older women. Sometimes they stop checking, and should they continue?
Yeah, so I think, we have the screening guidelines again for on average. So that average age is 45. The frequency is on an annual basis. However, again, you want to talk to your doctor. The science does show that in your 7th decade of life, so in your 70s, if you have not had breast cancer by then, things do slow down, and so you would talk to your doctor. Maybe you would have less mammograms. But again, I think each person should really monitor their own health and work with their own doctor. So if you have a family history of breast cancer, those guidelines may change for you. You may need to start having mammograms at an earlier age and or have mammograms, past your 70s. So it will really just depend. So I can't repeat enough that everyone be their own health advocate and really talk to their doctor about what's best for them based on their health. There are also other things that contribute, weight, physical activity, diet. So it's not really a one size fits everyone.
And let's talk about treatment. You mentioned that, the American Cancer Society has been at the forefront of bringing in various treatments for different types of cancers, including breast cancer. Where are we now? I'm speaking with Tswana Sewell from the American Cancer Society. Where are we now in terms of treatment, and what options do women have when they hear those words, you have breast cancer?
Yeah, the options are far greater over the last 4 decades. Along with the doctor that we funded that discovered tamoxifen, they also realized that they could treat breast cancer and it be way less invasive. So now there are all types of different treatments, localized radiation, there might still be chemo, you can have laparoscopic surgery. So it will really just depend on the tumor size, whether it's metastasized and, what's going on. But there are significant advancements in treatment and some really interesting work that's going on in clinical trials where, specific to metastasis, we have scientists right now who are, on the cusp of figuring out how to stop the spread of cancer by being able to detect dormant cancer cells that roam the body that typically doctors and scientists can't see, so we can't attack them. So that's really one of the dangerous parts of cancer, right? It's one thing to have a tumor in one place, but then if we can stop the spread of it throughout the body, that is a really significant advancement that's in clinical trials right now at the University of Maryland.
That is amazing. And do they know what causes cancer? Is that a dumb question?
No, it's not a dumb question. I mean, I think there are many things that contribute to people having cancer. I mentioned earlier, we know that obesity leads to several types of cancer. We know that, diet the way you eat may lead to certain types of cancer, because that ties into obesity again. Also, the lack of physical activity. So the American Cancer Society recommends 150 minutes, of physical activity every week. That can help reduce your risk for cancer. So there are some natural things that we can do, but again, that won't be a one-size-fits-all either. I was just going to say the last point is I think one of the reasons it's been so hard to find the cure, if you can hear the air quotes in that, is because cancer is not just one disease. It's over 200 different diseases. So, it's not really a simple answer or question, right? Like what leads to it, because we have all different types of cancer, which are all unique in the way they would be detected and treated.
And also it's important when we go back to talking about detection that it's not just on your maternal side that you can have genetic tendencies toward breast cancer.
Yeah, correct. So you need to look at all aspects of your family history and once again talk to your doctor about that so that they can make the best recommendation for you. And if you have questions, don't be shy about getting a second opinion.
I want to move on to how the American Cancer Society supports cancer patients and cancer survivors.
Yeah, so thanks for asking. The American Cancer Society, we provide direct services. We are open 24 hours a day, 7 days a week through our National Cancer Information Hotline. It's a 1-800 number, 1-800-227-2345, and you will get a live person to speak to. I feel like sometimes I lose people when I say a 1-800 number because they're like, oh man, I don't want to talk to a robot. But we have trained cancer specialists that can connect people to resources, provide information. You can ask to speak to an oncology nurse. If you're just up in the middle of the night and concerned about your diagnosis and want someone to talk to, we're here for that as well. We also provide access to care programs. So we know that sometimes people have to travel far for their best chance for effective treatment. So we have a network of more than 30 Hope Lodges across the country, which provide free lodging for the cancer patient and their caregiver, again, when they have to travel far for treatment. And we have one right in Baltimore on West Lexington Street. We also provide free rides to and from treatment for cancer patients. A lot of times treatment is during the day when loved ones may have to work, and it can be hard to drive yourself to and from chemotherapy. So we have a network of volunteers with our Road to Recovery program. Again, you would just call that 1-800 number for either of the two programs I just mentioned. We also have some peer support programs. One is called Reach to Recovery, where breast cancer survivors will actually take the time to talk to those who are newly diagnosed. We try to match them up with same stage, type of cancer, so that they can really share their experience and give a woman a glimpse into here's what you can expect and some tips on how to get through things.
And you mentioned the support aspect. How important is it for a woman to have a support plan when she is facing treatment and to know what, in fact, to expect?
Yeah, it's really critical. What we see when folks stay with us at the Hope Lodge, at first they're kind of like, I don't want to mingle with people. I just, want to go to my room. I've had treatment. When they leave there, they really have a whole new family and support system and network. And it's invaluable to be able to talk to someone, whether it's through that Reach to Recovery program I was talking about, the 1-800 number, Hope Lodge family or friends, right, who have been through the journey that you've already been through, so they can help you blaze your own path forward. When you're sick, it's tough. Just think about when you have a cold. It's tough taking care of yourself. So if you've been diagnosed with cancer, you really want to be able to lean on, family, friends, and of course, the American Cancer Society to walk you through that journey.
And as we close out here today, Tswana Sewell with the American Cancer Society, give us that 800 number one more time, please.
Yes, 1-800-227-2345.
And I'm assuming on your website people can find resources and ways to donate or volunteer or find more information.
Absolutely. You can go to cancer.org and find all of the information and resources that you need, as well as local and national events and volunteer opportunities that people can participate in.
Well, I want to thank you so much. I've been joined today on DMV Spotlight by Tswana Sewell with the American Cancer Society for Breast Cancer Awareness Month in October. Thank you again for joining me today.
Thank you for having me.
And join us again next week at this same time for DMV Spotlight.